Hi everybody. Happy Friday. I'm just hanging out waiting a minute here for Pamela to pop on. And we'll get chatting a little bit more about fertility massage today. And this is one topic that we have brushed on a little bit, but this is going to be cool today because Pamela and I have different backgrounds in this. And the last time that we talked about this, it was just me on, so we really didn't get to get into the nuances and the details and the similarities and the differences. And so I think that today will be exciting. Here comes Pamela. Hi, how are you?
Hi, I'm good. How are you?
I'm good. You look great. Yeah, I was just starting to mention that like we've touched on this topic a little bit about fertility, but it
Yeah.
wasn't as dynamic because it was just me that day. So I'm so excited to get to, chat with you a
Yeah.
bit more about this. And, you know, since we both have different backgrounds and different trainings and the types of fertility work that we do. And I'm sure that there are people listening who have trained in one or the other or
Yep.
considering one or the other. And so it'll be fun to get into that with you today.
Yeah, I'm excited because I think there's plenty of overlap, and then there's places where they differ from each other. So
Yeah.
it'll be good.
Yeah, it'll be
Yeah,
good.
and I heard someone talk about these topics recently, and so I'm excited for us to bring our own perspective. I do think there are a lot of people looking for this body work recently, and I think, like you said, therapists that maybe are thinking about exploring one of these options, and it'll be good.
Yeah. I don't know where you want to start with this, but maybe do you want to talk a little bit about what led you to study Arvigo Mayan Abdominal Massage? Good Lord.
Yeah,
And just like a little bit about like what you found in the training, and maybe I can share the same, and then we can get into, some of the details and yeah,
yeah.
where they overlap, where they differ.
hmm Yeah, so I had been doing, I mean, it was probably 2013, 14 when I came across Arvigo, and it just happened to be, I'd already been doing all the doula prenatal women's work, right? And I'd already been Carol's training for years. And so that foundation was there, but then I don't even remember how it kind of came into my consciousness, but what happened was my son was about to graduate high school, and it was super stressful,
Mhm.
and the training popped up for me, and I saw like how much it was, and um everything, and I kind of put it out of my mind. And then a week later, I was just like ready to kind of like lose my mind. I was like, oh my gosh, like life is really stressful. And I
Yeah.
happened to look at my bank account, and I had like almost the exact amount extra in there for the training. And I was like, oh, I'm going. I just booked it. And,
Mhm.
and so it was like it felt like synchronicity,
Mhm.
kismet. So, yeah, and so at that time, the trainings were broken down a little differently than they are today.
Yeah.
So I did what were we calling it, self-care class at the time. It was like the basic foundation level you had to take before you could do anything else.
Yeah, and I was gonna say
Mm.
they at that time they structured it that way, was my
Yeah.
understanding. Yeah.
Yeah. hmm Yeah. So,
And anybody
I
could take that class, even if you
that's
weren't a
right.
practitioner. Yeah, that's
Yes, it was
cool. So
available. It
empowering.
was
Yeah.
great. Yeah, available to anybody. And there still is, a little.
Sorry. I was trying to put my camera down and it like broke off the. Okay. Sorry.
Hey, this is real. This is live.
This is live. Yeah.
This is,
Let me
this is.
try it
It
again. I
feels
gotta get back on.
very much like a Monday here. It's just been pouring rain.
We got rain out here too
It's been
recently.
for days. Like my backyard's flooded, streets are flooded.
Oh wow.
Clients are canceling.
Oh, because it's
So
just unsafe to maybe even be
yeah, a
on the.
lot of this. Yeah, so lots of water out here already, and now there's nowhere for it to go. So Anyway, so it's feeling the energy's a little weird. So when
It,
your camera fell, I'm just like, oh yeah,
I
no big
know.
deal.
I got it on another, it's definitely a different angle here, but it's holding, so that's the most important thing. Um,
Yeah. Yeah. Okay. So the Arvigo trainings at that time, yes, anyone could jump into that first level, and there are still similar classes available. Yeah, that's all I'll say about that. And then a year later, I went and I did um, the level one, and I actually went to Belize to do that. And that
mm,
was, you know, so I think that was magical by itself. Being in Belize with Rosita, where the lineage comes from, being on that land, hearing her tell stories about Donalihio Ponte. And so he was the shaman that taught her the work,
mhm.
um, was magical. But what it really ultimately did for my practice was integrated the that really deep womb wisdom spiritual aspect of healing, and with the very technical work that I was doing from Carol,
Yeah.
right? And so not to say that the Arvigo work, some of it is not technical. We are structurally making changes in the body, but it very, very much is about incorporating intuition and that divine feminine energy, and helping women to really reconnect and with that deep
Of course.
wisdom.
Yeah.
Yeah. And there's profound healing in that, because I feel like so many of us are disconnected from that part of ourselves. And especially when the women show up needing the work, like many of them have either had some trauma or, multiple miscarriages, or there's some emotional armoring, or there's different aspects that we need to work through, right? Or they need to work through, which is why they show up. And I'm just a facilitator for that, and help them tap back in
And
to that inner knowing.
are you seeing clients mostly who are seeking this work because they're looking to conceive and that it's largely fertility based, or are you seeing clients for other reasons as well?
Yeah. So I think maybe this is where it differentiates from Mercier like the most, is that I have a lot of women who show up for fertility work specifically, but it's not just that. It's digestive. It's, like I said, the emotional armoring, the trauma, the womb healing that needs to happen. Um, there's digestive issues. They come because they've got chronic IBD,
Yeah.
dealing with Crohn's or something.
Yeah.
Uh, blocked fallopian, just such a wide range, right?
Yeah.
Menstrual disorders, like, yeah.
Yeah.
hmm So
Yeah.
I tend to, or maybe I've tended to promote the fertility work a little more recently,
Mhm.
but that's not the majority, especially in the beginning. That was not the majority of who I was seeing. Yeah.
Yeah. Yeah. And I mean, I was going to say too that Mercia can be used, for outside of the scope of fertility as well. But I would say a lot of our clients, even if I'm like, drawing them in the sense that we're like here to help you conceive, the reproductive system and the digestive system, we separate them in our minds, right? But it's
Yeah,
hard to not work on one without influencing the other. And so,
absolutely.
yeah, we have lots of clients who have had, they go hand in hand, right? If one system is not functioning optimally, it can often affect the other, whether that, like you said, looks like, Crohn's, or we see lots of clients with SIBO, or,
Yeah.
any kind of, gut inflammation, all kinds of stuff. So, yeah,
Yeah. Or abdominal surgeries, right? How about like just other abdominal surgeries and that scar tissue, that fascial binding,
yeah.
right? So, yeah. So somebody is watching, and they asked what the name of the training is. So that came up on my screen. I don't know
I
if
don't
you
see
saw.
the comments on my side. I don't know what the deal is. If it's like you would think
Yeah,
that the host should be able to
right.
see the comments, but I
Okay.
can't. So yeah,
Yeah.
thank you for keeping an eye on them. Yeah,
Yes.
I can write a comment, but I can't see any of the comments. That's
Yeah.
strange.
Okay, so the trainings that we are speaking directly about today are what used to be known as Arvigo Maya Abdominal Therapy, and it's no longer, that doesn't exist by itself anymore. So now we have the Abdominal Therapy Collective and Talish Indigenous Healing Arts. Yeah, Talish, I think is the way they pronounce it. So yeah, there's been a split, and the lineage has continued in different aspects now. So,
Yeah. And then my training background is in Mercier Therapy.
so yeah. So tell us more, Sparrow. I would love to hear more about Mercier.
Yeah, sure. Yeah, just from my perspective, I had been working, hands-on with pregnant and postpartum women for a few years, and I was seeing some clients on a regular basis who were, successfully pregnant. Like that's how I met them and was working with them through their pregnancies. But they started to share with me just some of what it took for them to have gotten pregnant. And a few of them had gone through IVF, and I feel like those were the heaviest sort of conversations, just in terms of, I don't think people always understand like how fragmenting it can feel for certain people. Fragmenting in the sense that it can break down your body in some ways, it can break down your marriage in some ways, it can break down your finances. Like it's a lot to ask. Um, and um, and I just remember like really listening to this, and it was sort of the first time that I was really starting to get a sense of the cost, right? And this is even the cost for somebody who, like, I was seeing them and it was successful, right? Like they were pregnant, they were far into their pregnancy, like things were going well, but they were still processing what they had been through. And even thinking about, like, we don't know if we're going to even be able to have a sibling for this baby or not,
Mm-hmm.
or what that
Right.
path looked like. And that really started to get my wheels turning, because I was like, clearly, like, I have good hands-on skills, and clearly I love sitting in this space with women and families and helping them expand their families. And I just sort of thought, like, I wonder what else I could learn to do to help before they even, meet me in this stage. And I had another colleague who had trained with Dr. Mercier. It was sort of on the early end of when she started training people. Um, and I had received some work from her, and then I had also done quite a bit of research, and I really liked that there was a 4-year study that backed up her work. She put a lot of time and effort into doing that. Um, and that felt helpful for me as a practitioner to lean on that a little bit. And yeah, I went out to Chicago and drove to the little suburb. Well, actually, I took a Uber to like the little suburb in St. Charles where she lives and works and teaches. And it was a small class, and it was great. It was life changing. And um, I remember receiving the work, and it was so profound. Like I had never had work that deep ever. And I don't know if this is also true for Arvigo, or maybe it depends on who you're working with, but the work, Mercier is a 360-degree therapy. So we're working on the front, the sides, and the back of the pelvis. And yeah, I just remember, like, after the first day of class, walking back to my room in the hotel where we were staying, and I felt like I was floating. It
Mm-hmm.
was so profound. Like it was almost like that feeling like you get when you've been on a treadmill for a long time, and then you suddenly get off and you just sort of feel like you're like
Yeah.
moving. And I was like, wow, this is really yeah, it was profound and interesting. And so that was in 2017, and I've worked with many women and families since then. And the majority of them, close to about 80% of those families have gone on to conceive. And that's felt, I mean, it's like, it feels good to be a part of that.
Yeah.
It feels good to be a part of that in a way that, like what you were talking about, helps them connect with themselves, right? Because it's
Mhm.
not just about promising pregnancy, which no one can do.
Right. Right. You
Yeah.
can't.
No one
Mhm.
can do that. But what we've seen consistently is that they just have better pelvic health.
Mhm.
And we do exit surveys too for all of our work. And 100% of our clients say that their stress has gone down significantly.
Yeah.
And their hope has gone up. And it's like, that's huge for a lot of people. That's
Yeah.
huge for a lot of relationships. And so it has felt like the right, it complements everything that we were doing. And then like I'm sure you've had it too, like helping someone conceive and then getting to move through their pregnancy and postpartum
Oh
with them. Like
yeah.
it just like doesn't get much
Yeah.
better than that, right?
Yeah. The whole thing is beautiful, right? And like you said, even if for someone, if they didn't get pregnant, their life is different. Their relationship to their body is different. Their
Yeah.
everything is changed
Yeah.
significantly. Yeah. Hmm.
Yeah. And I mean, the
Hmm.
structural stuff is pretty much completely left out of the medical uh, framework, except for doing the HSG, like the
Right.
histiosalpingogram. Like they'll look and they'll see if the tubes are patent, but aside
Mhm.
from that, like they're not looking at scar tissue. They're not looking
No.
at uterine positioning. They're not
No.
looking at any of those things. Yeah.
No, this area gets completely missed in the realm of IVF, IUI,
Yeah.
fertility treatment. Yeah, management. Yeah, it's really, and I don't know about I don't know how this is going for you so far, but I've found that the doctors are fairly unreceptive to wanting to talk about fertility massage. Some of them, like if I happen to know them personally, it's better, but so far they're not super open to the idea. But you,
Um,
maybe it comes different perspective for you. Hmm.
I was gonna say, like, I have had a couple of reproductive endocrinologists who were open to it. And I think that a lot of them, I think because so many of them are open to acupuncture, right? Because I think that there's more
Yes.
research,
Yeah.
right?
Yeah. Uh-huh.
And acupuncture is great, but again, like some of even what they do is not going to address like the underlying structural
Yeah.
pieces that we get to. And some women are not even really sure anatomically, where is my womb, like where are my
Right.
ovaries, right? And
Yeah.
this type of work, like we drop them right into their pelvis, like there's
Yeah.
no denying, right?
Yeah.
You're sort of forced to be in relationship and be in acknowledgement of this space,
Yeah.
and in a way that I don't think other modalities ask that of women
Mhm.
in the same way. So I have had like a couple of reproductive endocrinologists who have been warm-ish. It's
Mhm.
mostly like we share a client and the client goes back and raves, and they're like, well, you seem less stressful and you're a lot less
Yes.
stress on me, therefore I will,
Yeah, that's
yeah.
how it works usually, right? As the client says, I'm doing this thing, I love it, whatever. And then they'll be like, oh, well, you can send some cards.
Yeah. And I
You know?
mean, the tricky thing too, I don't know if you agree, but so I will meet a client wherever they're at, right? So Mercier can be used as a standalone therapy, or it can be used to help
Mhm.
prep the body for either IUI or IVF.
Yeah.
Um, I tend to try and have my clients, if they're even a tiny bit open to it or a little bit curious about it, try and avoid the path of IVF if at all
Oh,
possible.
yeah.
Like,
Yes.
and so that's where you can run into, you know, that's
Yeah.
where you can potentially butt heads with with the reproductive endocrinologist if you are
Yeah.
trying to get clients to consider waiting,
Right.
seeing if they really need this, huge intervention. And Dr. Mercier used an analogy that I think is so great. She's like, why use a sledgehammer when a push pin will do?
Yeah. Yeah. Arvigo says something very similar, like give Mother Nature half a chance and she'll always find a way,
Yeah,
right?
I love that.
So
Yeah.
we, so I suggest a 3-month protocol before they, but some of them come, they've already had a couple of failed
Right.
rounds of IVF, right?
Yeah.
Or they are already scheduled and now they're like trying to get it in real quick before
Yes.
we start.
Yes.
And that's fine. Like you said, we'll meet you wherever you are, no problem. And I'll work around whatever we need to do. I just had someone, she did a month with me and then she was like, okay, I'm just going to go do the IVF. I was like, okay, uh, she was pregnant when she got there. They did her blood work and she didn't need, yeah. So
Amazing.
that was exciting. Yeah.
Yeah.
So, I mean, there's so many different scenarios, but mhm,
Yeah. And I've seen a lot of those different scenarios play out
mhm,
too. I've had clients that plan to do IVF, or had like a past frozen embryo and they were going to transfer it and then they got pregnant on their own. And
right. Yeah.
yeah, every scenario, and then, people who have invested into multiple rounds of IVF and were still able to conceive naturally.
Yeah.
Other people who, were fully committed to that path, and that's totally fine,
Mhm.
because there's so much pressure, right? There's so much pressure
Yeah.
on just, especially this the timeline, if you're if you're 40 or over, I mean, it's
Mhm.
just the way that, you're spoken to. It's just like you're just one big ticking
Yeah.
clock. And so it can feel very risky to be asked to give something natural a chance when you're, operating under that
Yeah.
mindset and buying into that mindset, which is hard not to. Like, I totally get that.
Mhm.
Um, yeah. And yet, sometimes the holistic way is the fastest way in the end.
Yeah. I mean, well, you talked about somebody who's wanting to have a sibling or, other things like you're really setting your body up for success with, you know, doing the natural therapy first or in lieu of, or, however it works for you. Yeah. Yes. And that time clock is, it's all around them. They're surrounded by the societal, influences of how old they are.
Yeah.
And it's kind of, it's hard to get away from that. Yeah.
It
Yeah.
is, yeah. And if they've had even, a consult, even with
Right.
an IVF clinic, they will really,
Yeah.
and we operate under very different pretenses, in the sense that, like, our work, like the holistic work, is that your body just might need some support and it knows what to do, right?
That's right.
Versus don't worry, we can hijack your body and make it do what we want it to do, which
Yeah. It's
is
a very different
sometimes true,
mindset.
and sometimes true and sometimes not so much.
That's right. Yeah. Yeah. And I mean, they usually will help the next group of clients, whether it's 5 or 10, and those women will all be on the same trajectory with the fertility doctor at the same course, right? And
Mhm.
yeah, so those meds and the meds are intense and the stress is intense and there's a lot of aspects to that. Yeah, we're going
Yeah,
in the
and there's
opposite direction. We're saying take a break from everything and breathe through this and get comfortable with your body and here you are, right?
and let's optimize your body. Your body
Yeah.
wants to do this. Your body
Hmm.
is made to do this. Yeah, it
Yeah.
is. It's very different. Um, yeah, and I mean, it really is a hijacking of the body, the other route with all of the medications, and not everyone responds the same way. I've had clients who have spent, just the meds are so expensive, right?
Hmm.
And I've
Yeah.
had clients who they didn't suppress ovulation. They ovulated, they missed their window.
Yeah.
You know, they weren't paying close enough attention to her cycle. I
Mhm.
mean, it's a lot. That's a lot to ask. Versus, getting to know your body, and like, to whatever extent someone is interested, like, I'm always happy to include education in what I'm doing as well. So, like, menstrual cycle education, And like even talking about something as simple as like, are you tracking your cycle can mean so many different things to so many different people. Like most people are just, if you ask them if they're tracking, they're like, well, yeah, I put it in my period app. And so I know how many days it's been since my last cycle, but like there's no other signs that they're tracking, maybe not temperature, you know, it's,
Yeah.
you have to really get specific about what does that mean to you.
Yeah.
And
So yeah, let's talk. I mean, if it's okay, I think it'd be interesting. Yeah, so we do a lot of self-care and education, right? So talking about and giving them the basics for learning about their menstrual cycle, maybe for the first time,
yeah,
right? When, how do you know if you're ovulating? What does that look like? Are you looking at cervical mucus? All those different things. Um, and I was going to ask something else about, and then, so in Arvigo, there's very definitely like a piece of teaching after they've done their initial session, teaching them to do self-care on themselves. So
beautiful.
there's some abdominal work that they do every day, except for when they actually have their bleed, their moon cycle. Um, so that's a big part of the Arvigo therapy too. Yeah. And I think it's a longer process. From what I understand, the Mercier is a much shorter, definitive.
We
Yeah.
usually have it for it's 6 sessions, usually spaced a week apart for 6 weeks, and then
Yeah.
it can be tailored if someone is needing to have a shorter window to make it for a medically assisted cycle or something like that. Yeah,
Mhm. Yeah. Yeah. So the Arvigo sessions can be 3 weeks in a row and then a week off, and then
Mhm.
3 weeks in a row and a week off. Yeah.
Nice. Yeah.
So, yeah.
Um, Yeah, and then we're also, you know, we're doing like a huge health intake with them. It comes
Nice.
with a
Yeah.
consult. They're gonna get like a hands-on assessment as part of that consult for them to even get a sense of the depth of the work so they can even see if that's something that they want to pursue for 6 more hours, you know? And,
Yeah.
and then we can give them feedback on like uterine positioning and freedom of movement and what we're finding in there. So it's a whole assessment, and then the actual um, health intake. It's a lot of personalized information, and so we will give clients an onboarding and an offboarding tailored lifestyle recommendations. So whether that's simple, a lot of it is simple. Some of it, can be a little bit more, tailored and in depth, but some of it is just like, you know, use blue light blocking glasses after 8 p.m. and try and get at least 8 hours of sleep and eat breakfast within the first hour of waking up, because you want your body to know immediately that there is enough here to have a robust ovulation, and you can communicate
Yeah.
that to your body with simple things like that. Getting sunlight on your skin,
Yeah.
you know
Right.
a
Right.
lot of this
Yeah.
stuff isn't huge, but some of it, like, it does take a lot of mindfulness to work that into your day, or to like look at your life and be like, ooh, there's like some holes here.
Yeah. Yeah. Yes. Same. We do a lot of lifestyle, and I bring in a lot for myself, a lot of the Ayurvedic perspective, just because that's part of
Love
my
that.
background. So that is nice. But something I think is important, difference is that the Arvigo work is not as deep, I don't believe, as the Mercier therapy, right? So it is deep abdominal work, but it is, from what I understand, it's not as deep, and it's not as, there's not as many holds as Mercier therapy.
I believe that is true. And I have had past clients who have had both, and that was the feedback that I
Okay.
got for them. But it's
Mm-hmm.
also hard to know because it might be practitioner based. But I mean,
Could
I don't
be.
know. I'm knuckle deep,
Mm-hmm.
in clients.
Yeah.
It's deep work. And yeah,
Mhm.
we're working on the suspensory ligaments of the ovaries. We're working on the uterus itself. And, I'm looking at all the different vectors and how much freedom the uterus
Mhm.
has to move or not move, and in which directions is it, holding. And then also bouncing on the uterus. Hopefully there's some bounce there. Hopefully it has some freedom to spring back under my fingertips. But if it doesn't, if it has that kind of like boggy, sinking feeling, then I'm thinking about what's going on in the sacrouterine ligament in the back and how tight or restricted or retroverted that uterus might be.
Yeah.
So yeah,
Mhm.
yeah, it's
Those similarities for sure. All of that but not quite as deep. Yeah.
Yeah.
Mhm.
Yeah, and then the structure seems a little different, but for
Mhm.
Mercy, like we always tell our clients that the 6 hours of work, perhaps because it is so deep, um, that it holds for 12 months. So as long as somebody doesn't have any
Mhm.
kind of like accident, like a,
Yeah. Car
fall,
accident.
that
Mhm.
yeah, anything to their pelvis, the work
Yeah.
will hold. So,
Yeah.
which is nice too, because it's like there's not a whole lot of, you have to come back and constantly get, because it's an
Mhm.
expensive program too, not nearly as expensive clearly as, an IVF route or anything like that.
Right.
But I think it's nice to be able to say to people like this work will last.
Mhm.
And I think, aside from like the structural stuff that we're doing and finding where the adhesions are, the imbalances are, and I'm sure Arvigo has to do this as well. I don't think there's any way that it couldn't, but one of the byproducts of this work is that when you are stimulating the ovaries in this way, you're improving the hormonal communication, right?
Yes.
Stimulating the ovaries stimulates the pituitary, right? And
Absolutely.
then
Yeah.
you start this whole cascade of hormones that are better produced and better communicating, and then one follows the other, and cycles improve because of that as well.
Yes. Yeah. Yeah. The very first thing, one of, during the first session is, your period may come early or late because we are changing hormonal balance. So yeah.
Yeah.
Hmm.
Yeah, and we see that, and we kind of try, again, like also try and give people a heads up, because they're like, is this
Yeah.
normal? We're like, it can change the trajectory of your cycle, and then it will usually have a new and healthier rhythm.
Right. Yeah. 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 Yeah,
Yeah.
and I also thought about prolapse. That's one of the other things that we see a lot of, like a minor bladder prolapse or a rectocele or something. Yeah. So,
Yeah,
yeah.
and that can happen for all kinds of reasons, but
Hmm.
definitely if someone has had a previous birth, that's going
Hmm.
to, and
Yeah.
previous birth,
And
birth trauma, not
hysterectomy.
resting. Oh, yeah.
Yeah. Hmm.
Yeah.
So, yeah.
Yeah. Um, yeah, and I feel like, we're already at time. It goes fast,
I
and we really
know.
like we scratch the surface, but it's so fascinating. And yeah, I love talking to you
Uh-huh.
about all this. So yeah.
Yes. Okay.
Well, we can circle back around for sure on like other fertility related topics and
Yeah,
2026. I feel like we've got pretty much the topics for the rest of the year mapped out. But we can definitely revisit things.
I think so. Yeah, it'll be great. And then I think we have maybe some guest speakers for 2026 as well coming up,
Yeah,
right?
I think that's
So,
going to be great. I
yeah.
mean, like, I'm sure people appreciate us, but I think it would be nice to get some other faces and perspectives in here.
Yeah.
And I did want to mention too, since it's tomorrow I'm leading a free masterclass
That's awesome.
about, yeah, thank you, but the reducing back and pelvic pain in pregnancy. And
Hmm.
so it's in the on the wall on Facebook with the link if anyone wants to join. But I just wanted to remind people that that's tomorrow if you want to hang out with me on a Saturday.
That's
So
great. It's exciting. What a great offer. Yeah. Hope everyone takes you up on it.
thank you.
Yeah, it's
Anything
great.
else going on with you?
Um, no, we're gonna do a little weekend jaunt to Texas to see our son for his birthday.
That's
And
exciting.
yeah, that'll be fun. And but I have classes coming up in February. Oh, I have some small group mentoring happening. So the next one is a 2 hour very basic intro to prenatal. So
Awesome.
yeah. Hmm.
Um, did you drop a link to that in the Facebook group at all, just so people
I
know?
have not, but I will do that. I would love to. And I had I have a breast massage course in October coming up. Yeah.
It's exciting.
So
Yeah. And is
yeah.
that one in
Yeah.
person or?
So it's virtual as well. Yeah. So this Wednesday, the 15th from 7 to 8 p.m. And then the following Wednesday. So this one is on breast massage for lactation support. And the following is post-op. So any post-surgery. Yeah.
Yeah,
Yeah.
definitely drop those links too. Those are
Okay.
wonderful, wonderful resources. Yeah,
Yeah.
so
I know I
exciting.
forget about it, but definitely.
Yeah, because I think this morning I was going through, there's like 15 new members just from today that came in.
Thanks.
So yeah,
That's good.
yeah, yeah. So welcome if you're watching.
Yes, welcome. Glad you're here. Yeah. I feel
Awesome.
like it's a great place to, get just to have those really intimate conversations about some of the prenatal stuff that doesn't happen in the bigger realms and the bigger groups. So I hope people
Yeah,
will take advantage of it. Yeah.
yeah, love it. Beautiful. I hope you have a good weekend and safe
Thank
travels to
you. Thanks.
Texas. And
Okay, enjoy your class tomorrow. I'll
thank
try and pop in
you.
if I can, but we'll see. Yeah.
Yeah, let me know. It'll be 10 a.m. my time, so I guess that's 1
Okay.
p.m. your time. Yeah, and it's
Yes.
gonna be 2 hours. So
Okay, good. Great.
yeah,
Okay.
awesome. And I'll
Yeah.
see you next week. Thanks everybody for watching. Take
See you next
care.
Friday.
See you next Friday.
Bye.
Bye.